we will end kind of, I think, a highly relevant question here. So are there resources for connecting with support groups or counseling services? And I think kind of the mission of GRACE, as we're presenting here, is to bringing you that information in a digestible format. But I also recognize that everyone digests and kind of processes information in different ways. Some of us turn to peers who are kind of sharing the same experiences. If you have a diagnosis, others want to like turn to articles, etc. And so there are, I think, I don't have the best answer for this, but there are multiple patient groups. So if you have a particular driver alteration, there are groups that have been formed. EGFR has one, ALK has one. There's programming put on by GRACE, Longevity, and others as well. I think just asking your doctor and also asking the social worker. There are also kind of cancer center and kind of practice-specific support groups that are available, and also some in communities too. I've had patients who really derive significant benefit from just reaching out locally to saying, who else? It may not be my exact type of cancer, but who else is suffering from cancer in my neighborhood? And going online and finding that and kind of having a buddy system or mentoring system.
I'll just add to that. I think there's a recognition that, you know, taking care of a patient is really it takes a village. It takes, you know, we talked a lot about the multidisciplinary, you know, kind of care team, but this, of course, also includes psychologists, palliative care specialists, and it's really nice to have all of these members of the care team being part. You know, at the VA recently, we have now integrated palliative care into some of our clinics, which is great. To have a palliative care specialist there with you when, you know, the medical oncologist is going to see the patient. I think that's, of course, the goal, and it depends on where you're getting your care. But I think regardless of whether you can get it at the time that you're being seen in medical oncology clinic, there's referrals for you know, psych onc, for palliative care, lots of different services. A lot of this is also through social work.
Exactly, and I think don't be shy or afraid to ask for help or additional resources.